Making sure we're good on Facebook.
Good afternoon, Kiba. How are you? Ready to get started?
And can everybody see the slideshow well?
Yes, I can.
All right, so we're gonna start. And see about Facebook. I keep checking it to make sure we're still on.
I'm watching you on Facebook.
So we're great. And
Just doing a check. You can hear me okay?
yes.
Okay, great.
Okay, so we're gonna start. Good evening. My name is Kiba Muller. I am the communications manager here at via HFA, and welcome to Housing Finance Authority's public meeting. It's a public hearing to provide updates on our Citizen Participation Plan and CDBG, the Community Development Block Grant Disaster Recovery Action Plan, Substantial Amendment number 2. We're going to conduct this hearing in 2 parts. We're first going to knock out the Citizen Participation Plan, and once that is complete and we receive comments, then we'll move on to the Action Plan Amendment number 2. Tonight with me, I'm starting on the Citizen Participation Plan first. And so tonight with me presenting on that is Executive Director Daryl Griffith. And the citizen participation plan we're updating you on is the vital components of all federal grants processes and how we reach out to the public who will be the beneficiaries of the funds issued. Director Griffith.
Thank you, Ms. Muller, and welcome everyone to our public meeting this evening. As Ms. Muller stated, the VIHFA is updating the Citizen Participation Plan. VIHFA administers the territory's funds for programs many of you are familiar with. We have the home ownership programs and the public and our homeless services. VIHFA also manages the disaster funding that comes from the federal government. The laws governing the programs require us to involve the community, provide information on the proposed projects, and request feedback from the people that will benefit from the use of funds. That's you and all of the people in the territory. The VIHFA Citizen Participation Plan is updated to include the disaster programs, to include social media as a platform for public participation, and also to allow alternative requirements where there is an existing emergency, such as our current healthcare pandemic environment with COVID-19. Ms. Muller will give you more details on the proposed updates to the plan.
Thank you, Director Griffith. So the territory receives funds on an annual basis for 4 programs. I'm not remembering to switch my slides, sorry. On 4 programs, the Community Development Block Grants, Emergency Solutions Grant, that's ESG, Home Investment Partnerships Program, which is just called HOME, and the Housing Trust Fund. These block grant programs are annually allocated in the US budget and are not dependent on disasters. So VIHFA has a consolidated plan to strategically use these annual allocations, which is updated every 5 years. HFA reports on the progress of the consolidated plan each year, and the annual plan is currently posted on our website for download now. So the Citizen Participation Plan includes details about these programs for you to review. And it is separate from the consolidated plan or the annual plan, although it contains information about all of the programs. So when a president declares a disaster has occurred in a territory and Congress passes legislation with funding to address said disaster, the government of the Virgin Islands is required to involve the public in determining how the money is used. So HFA has received CDBG, that's Community Development Block Grant, Disaster Recovery and Mitigation Funds for the 2017 hurricanes, Irma and Maria. We also received CDBG and ESG funds for the COVID-19 pandemic. Since VIHFA is required to inform and involve the public in decision-making on the use of the funds, DR and MIT have standalone action plans describing the use of the funds, and CDBG CV and ESG CV, those are COVID funds, are amended into the consolidated plan that I mentioned earlier. So the Citizen Participation Plan, which is located on our website, is available for review now and includes information on the disaster funding programs. So that's one of the major updates. We included information on all of these 4 listed disaster fundings that we have. So whenever the plan is updated, the public must be involved, Citizen Participation Plan. This process this evening and for the 30-day public comment period is taking place because we are updating. So the public hearing and the 30 days that this period is open, it's to gather inputs and feedback from you guys on how you perceive our plan. And it's important to note that legislation for disaster funding oftentimes reduces the public comment period to a window of less than 30 days. So this is a quick turnaround for us. So for the Citizen Participation Plan, HFA is following the process outlined in the plan. When either the consolidated plan or disaster action plan changes the funding for more than a set percentage or amount, or changes the people that will benefit from the use of the funds, it is called a substantial amendment and must follow the public participation process. If changes are just administrative in nature, such as a policy clarification or corrects typos or have a minimal amount of funding adjusted, HUD, that's the Housing and Urban Development Department, US Department, and the public are notified of the administrative changes 5 days prior to it taking effect. So this citizen participation plan update includes details on the types of amendments and actions that are required. It also includes the use of social media, which was not widely available when the last citizen participation plan was released around 2010. The update also includes a process for emergency situations, such as the current public health pandemic. So we want to hear from you. If you, excuse me, if you have comments on the citizen participation plan, you can state them. You have a 4-minute limit, or you can type them out in the chat function. If you decide to give an oral comment, you have 4 minutes. And then questions and comments will not be addressed during the live forum, but will be addressed in the action plan amendment. So I just wanted to be clear that this public hearing, we may answer some questions, but most of the questions and comments we are going to record, address them when we submit the amendment to HUD. Just wanted to be clear on that. We're not going to have an open dialogue. We will answer some questions, like I said, but this is really a formal hearing to receive comments and document them so that we can include them into the amendment when we submit it. So the public comment period is open until October 3rd. I'm sorry. It was open from September 3rd. So all feedback will be captured. And if you don't state them orally now, you can't, or you don't type them in the chat room, you can also email it to cdbg-dr@vihfa.gov, or you can mail them to 100 Lagoon Complex, Suite 4, and address it to the communications manager, and I will receive them. So we're gonna have a 2-minute window because we have a lot to get through on the action plan amendment number 2. So I'm gonna leave a 2-minute window for you guys to state your oral comments. And if we have none, we will move on. Okay, so hearing or seeing no comments, move on.
Kiva, before we move on to the substantial amendment, can we confirm that Ms. Desiree Rodriguez is on the line so we can have the translation?
Just being clear, we were doing the translation in the next one on next week.
Gotcha, thank you.
So what Antoinette was just mentioning, is that the next hearing that we will have will be next week, Wednesday, the 23rd. And during that meeting, we will have translation services, live translation services of this presentation.
Great.
So joining me for updates on the CDBG-DR Action Plan amendments are, again, Director Griffith, our Chief Disaster Recovery Officer, Mr. David Martin, our CDBG-DR Director, Antoinette Fleming, and Senior Policy Manager, Leslie Dickinson Maduro. Director Griffith, do you want to give some opening remarks on the Action Plan Amendment 2?
Yes, thank you, Ms. Muller. Hello, everyone. Thank you for joining us on Zoom and Facebook, and those will be recording, watching the recording later in the days to come. This is the second amendment to the Disaster Recovery Action Plan for Hurricanes Irma and Maria. The initial action plan was the first round of funds for $242 million. When the second round of funds was awarded for almost $780 million, VIHFA completed the first amendment. We are now proposing the second amendment for a new $53 million award for unmet infrastructure needs, and also to reallocate funding to carry out different priorities, including housing and the FEMA match, and for different priorities that you will discuss throughout the plan. We will be sharing the details of this proposed amendment. Please participate in the process. For this process is what outlines what we'll be doing for the Virgin Islands disaster recovery using HUD's Community Development Block Grant, disaster recovery, and mitigation funds. Ms. Muller?
So the goals for today's public hearing are threefold. We're going to update you on the current status of CDBG-DR programs. We're going to announce the new allocation for infrastructure unmet needs, and then we're going to gather feedback from you on what's being proposed, and we want your feedback and comments. So I'm going to hand it over to Antoinette so she can start it off.
And thank you, Kiva. So managing the disaster recovery funding is an ongoing process. Funding will be adjusted as the needs are identified and as priorities are identified. The first action plan, which was for the first allocation for disaster recovery funding, was presented to the public and approved by HUD. With tranche 2, the action plan was amended and the public was engaged, and the process began to provide transparency to the public and to request feedback on how the funds are to be used in the territory's recovery. There was an additional $53 million award that was granted to the USVI for unmet needs, especially as it relates to infrastructure unmet needs. This amendment, amendment number 2, will allocate the funds based on the priorities and in compliance with the conditions of award. So subrecipients are government entities, their agencies, and their nonprofits that receive funds to carry out specific projects. The process starts with a capacity assessment of the internal controls and policies of managing a federal award. Once the capacity assessment is completed, a subrecipient agreement is developed, allowing for the department or agency or even a nonprofit to apply for funds for a specific disaster recovery related project. The project agreement will be developed once the project application is fully approved and a notice to proceed is issued. No work can take place until the notice to proceed has been issued. There's a closeout process once the project is completed. The process for developers for affordable housing is slightly different. Developers submit an application and a project is underwritten. A loan agreement is executed with all parties instead of a subrecipient agreement. The project is commenced and the project is completed. And once the housing is occupied and placed in service, that project can get closed out. So on this side, I will provide updates of our current activities. To date, there have been 12 capacity assessments completed. The capacity assessment have been completed for UVI, Department of Human Services, DOL, Tourism, Department of Public Works, EDA, Housing Authority, Port Authority, WAPA, Waste Management, VITEMA, and Lieutenant Governor's Office. There are 3 on the way that are currently being reviewed, like 3 capacity assessment currently being reviewed by our office, St. Croix Foundation, so Lutheran Social Services, and VITAL. We have executed 8 subrecipient agreements. 4 subrecipient agreements are under development. There are also 3 subrecipients that are underway. So VITEMA, Waste Management, and Lieutenant Governor's Office. There are 4 agencies with a project agreement, and they include EDA for Vision 2040, WAPA for the Randolph-Harley Power Plant. Public Works has 2 road projects, the Dunu Road and the North Shore Road. Department of Tourism is also underway. Megan's Bay Junction is also underway. Housing Authority has a project agreement that is being, a DR application that is currently being amended and reviewed in our office. Because of COVID-19, HUD has issued a notice with a 1-year extension of expenditures. HFA will request a waiver to receive an additional year extension for a maximum of 2 years past the initial date of 2022. Continue now update. So the housing program for homeowners and the rental program or reconstruction have been approved and they are underway. The WAPA Randolph-Harley plan, as I mentioned, is also underway. And I mentioned before that the expenditure deadline was initially 2040. With the extension that was mentioned previously, HUD granted us, because of COVID, an extension to 2025. With the new requirement of COVID, we have the ability as a grantee to extend this extension to 2026 with further documentation. So at this moment, I will turn the mic over to Leslie Dickerson Maduro.
Good evening. The amount of CDBG funding provided to the territory is almost $2 billion. The funds have been announced in separate allocations called tranches. Each tranche must be separately approved by HUD before the dollars are available to spend. Tranches 1 and 2 have already been approved. Tranche 2A for $53 million was just announced, and the amendment defines how the funds will be spent. Once the amendment is approved, HUD will issue a grant agreement and the funds will be available for drawdown. Tranche 3, the mitigation tranche, has a separate action plan which is underway but is not part of today's discussion. This chart displays the allocation awarded to the territory through tranches. The initial disaster recovery funds allotted to the territory after the 2017 hurricanes only makes up 13% of the overall CDBG-DR mitigation and electrical grid funding to date. Tranche 2 is 41% for CDBG-DR, and Tranche 3, which is allocated for mitigation funding, is an additional 13%. Remember, this does not represent all of the funding awarded to the territory for the 2017 hurricanes. It is only CDBG-DR and mitigation amounts. FEMA funding, which is now close to $5 billion, is in addition to these funds. VITEMA and the Office of Disaster Recovery administers FEMA funding. We are requesting your input on the full action plan amendment number 2, which is located online at www.cdbgdr.vihfa.gov. The comment period is open from September 3rd through October 3rd at midnight Eastern Standard Time. If you have questions, you will have an opportunity on a first-come, first-served basis and will be provided a 4-minute maximum to state your comment. Add your first and last names in the chat feature. First come, first serve, and limited to 4 minutes per commenter. Typed comments can be submitted using the chat feature. Include your first and last name to ensure all comments are captured. Questions and comments will not be addressed during the live session, but will be addressed in the action plan amendment. CDBG-DR activities requirements. CDBG-DR recovery funds must have a direct tie to the storm. For instance, a project that makes repairs of damages sustained during the wind and rain. The activities have to be an eligible CDBG-DR activity. There are 3 types of national objectives. Each project must meet one of the national objectives based on a type of activity. And finally, 70% of the funds must benefit low and moderate income individuals and households. So now we'll have Mr. Martin discuss the unmet needs.
Thank you, Leslie. Funding that is provided after a disaster event is never enough to cover all the damages. When HUD uses the term unmet needs, it's the difference between the amount of damage and the amount of funding available. For instance, if a project has a damage assessment of $4 million and FEMA and insurance will cover $2 million, that will leave an unmet need of $2 million. In addition to the 2 disaster recovery tranches for $242 million and $779 million, and the $774 million awarded for mitigation, HUD announced an additional $53 million that is to be used for unmet needs for infrastructure projects and repairs. This $53 million, which we are calling Tranche 2A, can be used for roads, public facilities, waste management, and water and sewer projects. Because it is for infrastructure unmet needs and not for housing or economic revitalization, the funds are being added to the non-federal share or match program. What is that? Simply put, match is the non-federal share of cost that a grantee is required to contribute to accomplish the purpose of the grant. I'm delaying on my slides, sorry. So concerning the Tranche 2A, here are some eligible projects under the infrastructure program. It's important to note that power generation projects have specific requirements in addition to the specific funding allocation. The Randolph-Hartley Power Generation Project is being funded in Tranche 1. Future power generation projects will be funded through CDBG-DR and CDBG-MIT mitigation. And once the electric grid tranche is released, the HFA and WAPA will work closely with HUD to ensure the projects awarded meet all the special criteria for power generation projects. And if you can see with by the pie charts that the amended budgets concerning Amendment 1, the current budget, and Amendment 2, proposed budget, the increases are significant, like 50% for housing, and then the other one that stands out, it's a 10% increase for infrastructure. Housing is one of the highest priorities for recovery. Funding for the housing sector has significantly increased. To allow more clients to be served under the homeowner program, the funding has increased from $60 million to $150.2 million. And due to high demand for home ownership, This program has increased from 50 million to 70 million. The rental program remains the same at 25 million, and due to unmet needs in affordable housing, the public and affordable housing program funding has increased from 72 million to 81.5 million. These activities were previously included in the housing program in both the action plan and Amendment 1. This amendment creates a separate sector dedicated to public services and public facilities. Public facilities are defined as publicly owned facilities or buildings owned by nonprofits or agencies that are open to the public or serve persons with special needs. Examples of publicly owned facilities are libraries, recreational facilities, parks, or playgrounds. Examples of buildings owned by nonprofits or agencies are homeless or domestic violence shelters, nursing or group homes, or health clinics. Public services are activities undertaken to provide employment training, childcare, health services, substantial substance abuse treatment, and counseling. Also educational programs, fair housing counseling, services for senior citizens, and others. Emergency shelters are priority, so that residents have a place to safely ride out disaster events. Homes for the aged are also a priority, providing a safe environment for our elders. And then finally, facilities where clients can access critical public services such as food banks, homeless services, youth programs, and senior services are eligible under the Public Facility and Services Program. Here's a breakdown of the programs and the funding. You can see that the infrastructure funding exceeds 570 million. This includes, again, the aforementioned non-federal share program. With 5 billion in FEMA funding for the work being done, the Virgin Islands share for many of the projects is 10% of the total project. And the non-federal share is not just for infrastructure projects. It includes some housing projects as well as the STEP program. By the way, STEP is sheltering temporary and essential program. I know I messed up that P, but 10% of the 5 billion is roughly $500 million. Kiva, could you take the next slides?
Sure. So we have great news as it relates to our CDBG-DR and MIT grants. Our new expenditure deadline is 2025. And I'll let Antoinette give you a little bit more details on that.
Thank you, Kiva. Over the past few months, HFA has invited you to participate in the mitigation action plan process. Mitigation funds have a different criteria than the CDBG-DR program, but this funding has been allocated in the to the 2017 grantees, which we are proud of. As we said earlier, CDBG-DR must have a direct tie to the storm. For mitigation projects, must have components that prevent future losses or mitigate against impacts of future storms, assisting the territory to become more resilient. Some projects contain component of both disaster recovery and a tie to the storm and mitigation, preventing losses in future disaster events. Projects also address a FEMA priorities, such as, we call them lifelines, such as safety, food and water, and shelter, health, medical, energy, communication, transportation, and hazardous materials. We welcome your feedback and input on the proposed funding and use of CDBG-DR. I'm also going to turn it back over to Kiva just so we can get your comments on what you have heard today.
So before we move on, I'm going to go backwards really quickly and finish explaining the expenditure deadline. So given an unprecedented pandemic, we are currently experiencing and the restrictions that are in place, HUD has provided a year extension on the of CDBG-DR funds. So initially, when the territory executed its grant agreement in 2018, it was given a 6-year expenditure deadline. And due to the pandemic and our current restrictions, the territory's expenditure deadline was extended to 2025. So HUD has also given all grantees an opportunity to request 1 additional year for the expenditure deadline, which we will apply for. Therefore, via HFA will be submitting that request to get that extension to 2026. So now we want to hear from you. And I just wanted to, just paying attention and going through all of this. I just wanted to go back. I was writing some notes here. Just to make it clear about what CDBG-DR mitigation and all of the funding that we get from HUD, we like to consider it supplemental funding and not emergency funding. So some people get FEMA and HUD with all of the disaster recovery funding confused, and we are pretty much last chance money, if you want to say that. So FITEMA and ODR, that's Office of Disaster Recovery, they administer FEMA funding. So when you hear the territory has like $8 billion, that's not all us. Some of the efforts may look like the same because it's all disaster recovery, but they serve different purposes. And then when we say unmet need for the non-federal share, when we talk about tranche 2A and the $53 million allocation, it's easy to think about it. I know maybe a year or two ago after the hurricanes, you hear a lot of FEMA talks and terms about a cost share, with FEMA providing maybe 90%, and then the local government has to come up with 10%. Maybe those numbers may change from agency to agency, but that 10% share that we may have to come up with, the local government, that's what our local match program will provide. So it may sound like, well, it's all federal money going back or being used, but that was allowable with our HUD funds. If anybody want to jump in and give a different view of what I'm saying, wanted to make that somewhat clear if some people were just misunderstood about what the local match program is for. And moving on, like I say, we want to hear from you. And if you want to give some comments, please enter your name and affiliation if you have one in the comment section. If you'd like to make a verbal comment, like we said earlier, it's first come, first serve, and each participant, will have 4 minutes to provide a verbal comment. If you would rather provide a written comment, of course, type it in the chat room and also with your name and affiliation. Reiterating that not all questions and comments will be addressed during this live forum, but will be addressed in the action plan amendment, addressed and answered. Remember that the comment period is open until October 3rd. And just for everyone's situational awareness, on Thursday, we're going to present this same information via radio on 107.9 The Vibe at 9 to 10 a.m. And then next week, Tuesday, same information on 103.5 FM from 9:45 to 10:45. And then the second and last public hearing will be that Wednesday, the 23rd, at 6 p.m. again. And in that hearing, we'll have Spanish translation for those that may need. So I am going to leave the floor open for about 2 minutes. And then after that, we're gonna wrap up.
Ms. Muller, if I may, I'd just like to inform the public of the website. The website, once again, is www, for easier reference, www.vihfa.gov, and simply click on disaster recovery. One of the things that I would like to do during this time, since we, Ms. Muller, do we have any questions currently?
Not yet.
So I would like to just go over the different funding that we have for the different programs currently. Because we did mention the full dollar amount that we have funded, but underneath our housing program, the total for homeowner rehab and reconstruction that we mentioned is $150 million. $150,203,038 to be exact. For our new housing and infrastructure, that's 70 million. For our rental and rehab, it's 25 million. And for public and affordable housing, it's 81,500. We've received applications, and you can go on the authority's website to see the particular projects that applications are currently in for. We have Croyville Preservation Associates, the Virgin Islands Housing Authority has Walter I.M. Hodge Pavilion, Williams Delight Villas, and these are projects that are considered underneath the current plan. Williams Delight Villas, Ralph D. Shabert Phase 1, Duna Redevelopment Phase 1 as well, which is the Tutu housing replacement. Under public services, we have a total program funding of $500,000. For rehab reconstruction of new construction of facilities, we've set aside $37 million. That includes set aside for the Herbert Gregg complex of 7.5 million, Queen Louise Home for the Aged for 7.5 million as well. We also have the non-federal match for disaster recovery, which is the most substantial change that we've made to the action plan, which is now funded for a little bit over $432 million to meet the territory's match need of the 10% for the $5 billion that's been allocated. We also have infrastructure repair and resilience program totaling $45,750,000. That includes the Dunu bypass redevelopment by Public Works, North Side Highway development, also the Virgin Islands Water and Power Authority, Smith Bay and Friedenhall waterline expansion, Anna's Retreat waterline expansion, and of course we have the aforementioned Randolph Harley Power Plant, which is a $95 million project. We've also included projects for port and airports programs totaling $38 million. The Virgin Islands Port Authority is working on applications for both the Charlotte Amalie Harbor and the harbor dredging. The Virgin Islands Department of Tourism has a tourism marketing campaign for a total of $10 million. And we also have very important workforce development program totaling $17 million in the action plan too as well. And we have a planning grants available for a total amount of $18 million. And if you go to www.vihfa.gov, click on disaster recovery, you can read the full action plan and make comments to us to let us know if you think the territory, the authority is on the right track, or if you'd like to see some additional projects or some changes into our funding allocations for different things. Thank you, Ms. Muller.
Thank you, Mr. Griffith. If anyone would like to make a comment, feel free to unmute yourselves and state your comments. So what I'm also gonna do while I'm waiting, I'm gonna stop sharing this screen and take you to our website to show you where the action plan and citizen participation plan are located for your review and download. Still waiting on comments. If you do, feel free to unmute yourselves and state them for the record. So I'm sharing the screen of our website. On the action plan amendment number 2, there's a bar on the right-hand side where you can click to learn more about it. It's a little narrative about what the CDBG-DR is. So the draft substantial amendment number 2 is located as you scroll right down. It's in English and Spanish. The full action plan is there as well as a summary. And there's a little graphic about what the amendment 2 will be doing. So you can feel free to click any of these, and then citizen participation plan drafts are under citizen participation here. And if you scroll down, the plan drafts are here and ways to provide public comments between September 3rd and October 3rd. So, still waiting on comments if you guys have them. So I'm also going to restate that we are, stop sharing that. We will be on the radio on Thursday. We'll be on the radio on Thursday, 107.9 FM, The Vibe in St. Thomas at between 9 and 10 a.m. And on Tuesday we'll be on 103.5 FM rebroadcasting in St. Croix from 9:45 to 10:45, discussing citizen participation plan and action plan amendment number 2. And then Wednesday, we'll be back here on Zoom, same link, same time, 6 p.m. to discuss, and we'll also have a Spanish translation there as well. And you can submit your comments via email at cdbgdr@vihfa.gov or mail them to our St. Croix office. So I'm gonna leave this open for a few more minutes, and then we will wrap up if there are no questions or comments from the viewing and listening public. So we are going to wrap up, seeing and hearing no comments so far. Director Griffith, feel free to wrap up when you are ready.
Thank you everyone for attending. As Ms. Muller said earlier, we're gonna have another presentation, and of this, we'll do it on Facebook as again and on Zoom, and we will also be on the radio to advertise the public comment period so that everyone can know what's happening with the CDBG-DR, the Community Development Block Grant Disaster Recovery Funds in the territory. I'd like to thank you all for watching. Please look out for us on radio, television, and every media that you can think of as we try to bring this information out to make sure that the Virgin Islands public is as engaged as possible in what we're going to do with these disaster recovery funds. Thank you all and have a great night.
Thank you.